Well, let's look at this gut-brain relationship, recognizing there's so many correlations between what goes on in the brain and goes on in the gut. This study from the Lancet shows that people with Crohn's disease or ulcerative colitis, their risk of having white matter plaque in their brain is almost as high as that in patients with MS. And these are patients without MS. And here's what they found. Percent of people with white matter lesions in their brain. These are asymptomatic people, but as part of the study, in a GI practice in a university, they had brain MRIs and they found that they had plaque in their brain from ulcerative colitis, an immune issue. Prevalence of MS in inflammatory bowel disease is 370 times more than expected. And this is what they said at the Mayo Clinic. Our data do not support that central nervous system involvement is an extraintestinal manifestation of IBD. No, that can't be. Because IBD is here and MS is over here, and those departments are probably across the hall from each other, so that there could never be a relationship between what goes on in your gut and what goes on in your brain. Interestingly enough, we also see white matter abnormalities in people with gluten sensitivity. And this study, also from the journal Neurology, showed that they found individuals with white matter abnormalities in their brain who had their positive gluten antibodies or celiac disease, but 6 out of 10 of these patients had no gastrointestinal disorder at all. So this is an extra-intestinal manifestation of gluten sensitivity. Look at the white matter abnormalities. I wish I had a laser pointer. I'd point it out to you. But nonetheless, I'm hopeful that you can see that. Shouldn't we be checking for gluten sensitivity in patients if it can do this to the human brain? Well, how common is gluten sensitivity? How common is celiac disease? Well, it affects 1 in 100 people. It is the most common disease of humanity. So, you would want to know your anti-gliadin status. That would be an important test. I would think far more important than knowing your cholesterol or knowing your PSA. Because if you have gluten sensitivity and you're eating a lot of gluten-containing foods like wheat, barley, rye, etc., which is ubiquitous in our society, it can do this to your brain, as published in the Lancet. Gluten sensitivity can be an exclusively neurological problem. In autistic children, they've got to have their gluten sensitivity checked. In children with ADHD, fundamental thing to check. Because when you have this gluten reaction in the brain, there's static on the line, there's not good radio reception because there's inflammation. Well, here's a little child who was brought to see me. Wonderful kid, and here's what happens to her. She thrusts her tongue out, jaw thrusting, involuntary contractions of her platysma, that's the muscle of the neck, 7 months better after a little craniosacral therapy. But nonetheless, the problem returns. Interestingly enough, she revealed that she had a history of diarrhea just before the onset with cramping abdominal pain. Something intestinal happened just before she was diagnosed as having, what? Tourette's. I mean, this is a child with grunting and contractions. Her examination is totally normal, and she has Tourette's syndrome. Sweet little kid. We looked at Lyme because there's been a very strong relationship with Lyme and Tourette's. It was negative. Her eosinophil count was slightly elevated, indicating some form of immune allergic activity was happening. Her anti-gliadin antibodies were significantly elevated. Anything over 30 is considered moderate to strongly positive. So we took her off of gluten. We put her on some DHA, and her symptoms stopped in 2 days. And she's I think a teenager now. She's going to be a doctor, too. This kid is incredibly intelligent. But this was a kid who would have been on phenothiazines, probably. I mean, right? Wouldn't that be what she would have received, having been diagnosed as having, or Haldol, having been diagnosed with Tourette's syndrome, and for the rest of her life? Scary thing is, when you read the PDR, I'm going off topic for just a moment, when you read the PDR about methylphenidate and other stimulant drugs used for ADHD, there's a black box now indicating this can lead to Tourette's syndrome. And the studies now indicate that that is permanent. And that's a significant side effect of stimulant treatment for ADHD, where you stigmatize that person for the rest of his or her life. Something's wrong with that picture. Here's a fellow who lives in Texas, oddly enough, who visited us with some problems. He's got multiple sclerosis. His full workup, most of his problems at the time I saw him had to do with his eye movements and double vision. His lumbar puncture looked abnormal. His MRI was abnormal with plaque, especially down in the back there. There's classic finding of MS where you see those white matter plaques in the corpus callosum, which is pretty much a hallmark of MS. Interestingly, he's had lots of prostatitis and lots of antibiotics, had mono at age 19. Why the prostatitis is important for me, we did a study on on candida involvement in MS patients and published that 12 years ago, and found that people with a lot of candida overgrowth are at increased risk for MS. What causes candida overgrowth? Lots of antibiotic exposure. Nonetheless, his examination looks pretty good, but he does have these subjective complaints. What do you know? Candida albicans positive to diflucan, lactobacillus absent, as you would expect in a man having lots of antibiotics. That's a bad situation for the gut-brain relationship. I mean, what is a neurologist doing ordering stool tests on his patients? I mean, that is really way out there. Can you imagine? Anyway, he's significantly gluten sensitive. Look at his anti-gliadin antibody is way up there. So we put him on some diflucan, some probiotics, antioxidants, gluten-free diet, and we gave him some hyperbaric oxygen. Now, what is this crazy thing of giving patients hyperbaric oxygen? That is the standard of care for MS in Europe, all across Europe, and it's been so for a quarter century. The original articles here were published in the New England Journal of Medicine, finding it profoundly effective. So we use hyperbaric oxygen in treating MS with great success. Anyway, his symptoms resolve. He has no new lesions on his MRI. So, I see what happened. Anyway, so we're actually running the wrong program. No problem. Anyway, so this is our hyperbaric center. Just so you can see what hyperbarics is all about. You know, hyperbarics is really great for wound healing. That's what it's approved for in the hospitals. But so many other problems are well treated with hyperbaric oxygen therapy. And these are what hyperbaric chambers, this is our facility down in Naples. And these are what the chambers look like. These are monoplace chambers, meaning that one person goes in at a time. Each chamber has a television where people can go in the chamber, then we've piped the audio and they can watch a movie. And this is actually my dad who was getting treatment. And you just lie there on the gurney and the oxygen comes in and it feels wonderful. The chamber is pressurized with 100% oxygen. I installed outside in the parking lot when we first opened our center a decade ago, a tank 2.5 stories high filled with 5,000 gallons of liquid oxygen in Naples, Florida. This truck comes and fills it up and the whole parking lot froze because it leaked out the first time. There was a layer of ice in Naples, Florida in the summer on the parking lot, on the asphalt. It was really pretty amazing. So, and while people are being treated, our technicians are there with them, so you're able to talk to the patients throughout the course of the treatment. Well, I'd like to, 11, okay, we're good. This is a new topic, brain regeneration, neurogenesis. We can actually regrow brain cells. You know, this is new information. When I was in medical school, we were told, and you all remember this, that you got a certain number of brain cells when you were born, and then that was it. Every beer you drank, you lost 10,000 brain cells. Remember they used to tell us that? They did? I don't remember. But, obviously the brain has to have ability to regenerate itself because people improve at times from various types of problems. So let's look at what this is all about. In 1998, patients had been treated with BRDO, bromodeoxyuridine, a thymidine analog, and that labels DNA. It actually tags DNA while cells are replicating. And you can actually image bromodeoxyuridine. And after these patients, this is a form of chemotherapy, they actually looked in the human hippocampus of these individuals post-mortem, and interestingly enough found that in the hippocampus there was evidence of cells actually labeled with bromodeoxyuridine. What did that mean? It meant that there were actual cells in the human hippocampus, the area of the brain that degenerates in Alzheimer's disease. There were areas of the brain that were still replicating. I mean, that was pretty exciting. It was known prior to that probably some cells in what is called the olfactory epithelium might replicate, but this was very exciting information. Our studies demonstrate cell genesis occurs in human brains. The human brain retains this potential of self-renewal throughout life. Think about it. So that when we see these patients that are at the end stages, and people say, well, what can be done? And all you have to offer them is a cholinesterase inhibitor that we now show doesn't work. Look at this new technology. This is very exciting. Well, we look at various what are called neurotrophic